Hello, and welcome to the Cardiology podcast, Why We Do What We Do in Cardiology. In this audio series, we will discuss the practice-changing articles in cardiology from the past to the present. This is your episode for today.
In this episode, I will discuss a recent hot topic, the emerging role of artificial intelligence in cardiovascular medicine. The title is Artificial Intelligence for Cardiovascular Care, Part 1, Advances, JACC Review Topic of the Week. This was published in the Journal of the American College of Cardiology in June 2024. This review explores the current use and future directions of artificial intelligence, AI, in cardiology, providing an updated overview in 6 key areas: electrocardiography, telemetry and wearables, echocardiography, cardiovascular magnetic resonance, CMR, nuclear cardiology, cardiac computed tomography, CT, advanced electrophysiology studies, coronary angiography, and genetics or multiomics. It includes a glossary of relevant AI terms and detailed evaluations of recent studies, aiming to inform the cardiology community about the latest advancements at the intersection of AI and cardiology. An algorithm is a set of mathematical procedures to learn patterns from data. The area under the receiver operating characteristic curve, AUC, evaluates binary classification model performance. Artificial intelligence, AI, is the capability of a machine to imitate intelligent human behavior. Artificial neural networks are inspired by the human brain and teach computers to learn using layers of neurons. Classification predicts a categorical label of an input. Convolutional neural networks, CNNs, are deep learning algorithms optimized for processing grid-like data such as images. Deep learning is a subset of machine learning using artificial neural networks. Features are measurable properties of data used by algorithms to learn patterns or make predictions. Foundation models are trained on large amounts of unlabeled data for various tasks. Joint embedding transforms and maps different types of data into a shared feature space. Labels are the ground truth output used to train supervised learning models. Large language models recognize, summarize, translate, predict, and generate text content. Machine learning involves computers learning from experience without explicit programming. Preprocessing prepares raw data for training AI models. Reinforcement learning involves agents making decisions by maximizing cumulative rewards. Segmentation partitions an image into multiple segments. Semi-supervised learning uses both labeled and unlabeled data for training. Structured data is organized into a predefined format. Supervised learning involves training models using labeled data. Unstructured data lacks a predefined format and is used to discover hidden patterns. Unsupervised learning uses data without labels to uncover underlying structures or patterns. Wearables are electronic devices for data collection and health monitoring. Deep learning methods were applied to physiologic waveform, imaging, and multiomics data with clinical applications in cardiology. Cardiac AI investigators identified and reviewed relevant studies using mesh terms in PubMed, selecting studies based on size, number of sites, validation, citations, and importance to the field. The ECG is a cost-effective diagnostic tool. Efforts to automate ECG interpretation using deep learning techniques like CNNs have shown promise in arrhythmia classification and predicting paroxysmal atrial fibrillation with high accuracy. Deep learning models have improved the diagnosis of structural heart diseases and predicting conditions like LV systolic dysfunction, hypertrophic cardiomyopathy, and cardiac amyloidosis. AI in echocardiography focuses on improving image acquisition and interpretation. AI platforms help novice users obtain standard views and automate measurements like LV wall thickness, atrial size, and LVEF. These technologies enhance intra-observer and intra-observer variability and improve disease diagnosis. AI transforms CMR imaging from acquisition to disease diagnosis. It enhances image reconstruction, segmentation, and quantification. AI applications in nuclear cardiology and cardiac CT include improved prognostication, coronary calcium scoring, plaque burden quantification, and radiomic analyses. AI also addresses technical issues like image reconstruction and motion correction. AI integrates complex data sources for electrophysiology studies. It aids pre-procedural planning, intra-procedural guidance using extended reality, and post-procedural predictions. AI tools improve the identification of effective ablation targets and predict responses to therapies like cardiac resynchronization. AI assists with image acquisition, interpretation, and risk stratification in coronary angiography. It automates stenosis detection, plaque characterization, and fractional flow reserve computation. AI models enhance sensitivity and accuracy in identifying coronary conditions and improve procedural efficiencies. Machine learning improves risk prediction and variant interpretation in genomic data, leading to better diagnosis and risk assessment for cardiovascular diseases. AI methods enhance pathogenicity identification and integration into clinical care. AI in cardiovascular medicine shows promise in disease screening, integrating imaging data, and assisting clinicians with accurate diagnoses. Future efforts will focus on improving data quality, diversity, model generalizability, and promoting AI adoption in clinical practice. AI advancements in cardiology offer significant potential to enhance patient care through improved diagnostics, risk stratification, and personalized treatment plans. These technologies provide augmented intelligence to support clinicians in delivering better cardiovascular care.
Thank you for listening to this podcast, Why We Do What We Do in Cardiology. The information in this podcast is for general information only for medical professionals and is not intended to be a substitute for medical advice from a qualified healthcare professional. We hope you found this information helpful, and we look forward to seeing you on the next episode.